The hand cravat. For wounds in the hands, there are two types of hand cravats. These are the closed hand cravat and the open hand cravat. The closed hand cravat is usually used for cuts that occur horizontally on the hands of the patient. Start at the narrow cravat and place the apex on the wound. In this hand cravat, the hands are closed into a fist to put additional pressure on the wound and to control bleeding. Aim for a crisscross pattern in wrapping the bandage around the closed face of the patient. Make sure that the thumb is exposed to check for capillary refill later on. Wrap the bandage until both ends can be tied together. The open hand cravat is used as an alternative to closed hand cravat. Start at the narrow cravat and wrap the bandage around the open palm of the patient. Aim for a crisscross pattern. The open hand cravat is used for cases such as when the wound occurs vertically across the palm of the patient. This is because a vertical cut will worsen if the hands are closed into a fist. End with a square knot and tuck the ends in. Fingers should be exposed for capillary refill. The cravat of the head is used for burns on the scalp of the patient. Start at the open place and cover the head of the patient. The apex should be found behind the patient. Note that the 2-inch fold is made on the forehead of the patient to hide the extra ends later on. Twist the ends of the triangular bandage. Tie it in front of the forehead with a square knot. Hide the knot inside the 2-inch fold. Pull the apex and secure it by rolling it back in. Lightly pull on a portion of the triangular bandage at the top of the patient's head. The cravat of the front or back is made to act as a cover for burns. Start at the open face and place the apex on the shoulder of the patient. Wrap the ends around the patient's torso and tie it with a square knot on the sides same as the apex. The excess end will serve as a securing knot for the apex found above it. The jaw cravat is used to immobilize the jaw. Start at the narrow cravat. Place the apex on the cheek of the patient. Wrap the bandage over the head of the patient and cross the ends over the patient's temples. Tie it with a square knot over the other temple. Tuck the ends. The patient will not be able to move his or her jaw. The arm sling is used to immobilize the arm. There are two types of arm slings. These are the normal arm sling and the alternative arm sling. The normal arm sling is used for patients without clavicle fracture. Start at open face and tie an overhand knot up the apex. Then place the apex on the patient's elbow. Take both ends of the triangular bandage and put them over the patient's shoulders. Tie both ends behind the neck of the patient. Make sure that the hands or fingers of the patient are exposed to check for capillary refill. The alternative arm sling is used for patients with clavicle fracture. If you suspect that the patient has a broken collarbone, you may use the alternative method of doing an arm sling. Start at the open face and tie an overhand knot at the apex. Then place the apex on the patient's elbow. Take the inner and end of the triangular bandage and put it over the patient's shoulder. Take the outer end and insert it between the armpit of the patient. Tie both ends behind the patient. Make sure that the hands or fingers of the patient are exposed to check for capillary refill.